Welcome to the RN Mentor Podcast. I'm Dr. Ali Tayeb, nurse, educator, advocate, and United States Navy veteran. This show is about real conversations with nurses moving the profession forward. We discuss leadership, practice, policy, research, and more. What matters and why it matters. I'm glad you're here, so let's get started. Hello and welcome to another exciting episode of the RN Mentor Podcast. I am very delighted today to be joined by Dr. Kortney Floyd James. Dr. James is a nurse scientist, policy researcher, and clinician with over 15 years of experience in maternal and pediatric health. She's a health policy researcher at the RAND Corporation, an assistant adjunct professor at UCLA, and an associate editor for Nursing for Women's Health. Her work centers on Black maternal health with a focus on mental health, breastfeeding equity, and Medicaid policy. She uses mixed methods and partners with doulas, clinicians, and community organizations to make perinatal care more just, accessible, and responsive. As a mother, former pediatric NP, and mother-baby nurse, she brings both lived experience and clinical insight to her research and advocacy. Welcome to the show, Dr. James.
Thank you for the invitation.
Yeah, of course. I was so glad to run into you at the airport. I want to say we were both at AONL.
Yep.
Ran into you we talked there, and then ran into you at the airport on the way back. We both happen to live in LA, which is fantastic. We don't see any more of each other, but at least we're in
I
this.
know.
The choice is there if we wanted to, right?
Right,
So
right. Open invitation
open
at some
invitation.
point. Yeah.
Yes. So happy that I could have you on the show, and I'm going to jump straight into my first and only prepared question: is how did you get started in the world of nursing?
Yes. So I always say I became a nurse or I was a nurse before I ever knew like what nursing was. So I feel like the older you get, the more places you've lived and the longer your bio can be. And I just avoid all of that lengthy um, intro. But part of my childhood, I was born and later raised in South Carolina. And so a lot of my family members had health issues. So my great aunt, I was very blessed and fortunate enough that my great grandparents and great aunts helped raise me. And so my great aunt had diabetes and she was developing what I now know, as I grew up, knew to be diabetic neuropathy. And so she didn't have very good sensation in her fingers or toes, and I would have to help give her insulin shots. And I was as young as so I part of my childhood I grew up in Germany, but before that I was in South Carolina. So I did that at around 2, 3 years old,
Oh
helping
wow.
her with her injections. And then when we came back from Germany, I just picked up like I had never left. I was probably 10 then and helping her at her visits and helping, her prepare her meals and all those things and rubbing her feet and being like, oh, I called her Duty. And I'd be like, oh, Duty, your foot is bleeding. And she's like, oh, really? And she'd stepped on something, cut her foot,
Uh,
couldn't feel it, didn't know. So I'm like bandaging her up. Already a nurse, but did not know you're a nurse. This is nursing. I just loved my family and they had health issues and I wanted to take care of them. So I feel like I was just born to be a nurse. That's just what I've always been.
Beautiful, beautiful, very nice. I'm interested in this Germany thing.
Yeah.
Uh, how did your family end up in Germany?
Yeah, so my father was in the military. He was in the army. So
Uh,
we were stationed. He went to Germany before me and my mother did. But we lived in Germany for about 6 years. So in the same barracks, didn't hop all over. So many army brats have been like all over the world, and we were stationed here. And say we were in Germany for 6 years, and then he served in Desert Storm, and he was like, I'm out, no more." And so that's when we moved back to South Carolina. So not
all
a
right,
lot
all
of
right.
nomad lifestyle as an army brat, but that's
Yeah,
where we were.
I suspect that there may be an army thing going on there, but so
Yes,
I was correct.
exactly.
I was correct. Okay,
You were
because
right. You know.
usually people don't pick up and go to Germany, but usually
Exactly.
there's an army association there. So fantastic.
Hmm.
So thank you for your service and thank you for your for being a support to him during that time. Um, so how did you decide? How did you decide that you? At what point, even though, like you said, you were sort of almost raised to be a nurse, and that was part of your nature and the family dynamics. When did you decide, like, you know what, I'm going to go and apply for nursing school? How did that happen?
Yeah, you know what? I don't know. I just felt like at some point, I just came to know nursing and it felt like the right career path. There are always people who are like, well, why don't you want to be a doctor? You should be a
Mm,
doctor and not a nurse. And I was just like, no, nursing is what I want to do. And so in high school, I did do a few like summer internship programs, shadowing different healthcare workers. It wasn't always nurses. I think I worked with speech language pathologists who really took care of a lot of children, especially on that had autism spectrum disorder,
mm.
and like watching swallow studies, all these things in like 11th grade. And I was just like, oh, I don't. This is great, but it's not for me. And so when I got to work with nurses and
Yeah,
just watch them do their thing, I was like, this is for sure what I want to do. And so I just applied to the University of South Carolina, the other quote unquote USC, and got in. And that's all she wrote. That's all I ever, there was I think for a little while I thought about majoring in English because my mom was a librarian's assistant and read to me while she was pregnant and ever since I was born. And I just love books and writing.
nice.
And my English teachers just loved my writing and poetry. And I just thought it just came so natural. Surely that's what I will do. No, nursing just, plus, you always have a job. So
The
I was
job
like, as an
security is a
English
good thing.
major, what would I do? Am I just going to teach? Like, what does that look like? So I was like, okay, nursing for sure. So
Nice, nice. How was your experience in nursing school?
yeah, it was actually, looking back, it was a good experience. In the moment, it's just so intense and challenging, and the classes are, I won't say hard, I'll say challenging. Um, but I learned a lot. When I don't practice clinically now, but while I was practicing in Atlanta, I felt like a lot of the new nurses didn't get a lot of the experience that I was fortunate to have in my clinical rotations in undergrad. I mean, I worked as a student nurse on it's called med surge, but it was really more so like inpatient hospice, I feel,
Yeah,
for the 4 years or maybe 2 years, once I was further along in my nursing education. I worked there the whole time. And because they knew I was in nursing school, they allowed me to do a little more under their supervision, right?
right.
And just taught me all the things. So I did a lot. I really had very serious, intense instructors. I can't remember. I'm so sad I don't remember her name, but she was my med surg instructor. So she was the professor of the course, and then you would also get her, if you were quote unquote unlucky, as your clinical instructor. I feel like her name was Dr. Hagler. That's probably completely wrong, but she was an older woman. She had taught nursing students in like Saudi Arabia,
Oh,
all over Europe, back in the US. She was near retirement, but she was very intense, and everybody was like, you don't want her because she'll drill you on like the pharmacokinetics of the medication when you're in clinical rotation with her. She'll make sure that you went and got your patient charts, like reviewed your patient charts the day before. Like she is just very intense, which she was. However, I feel like that made me such a great nurse because I knew that she was expecting me to know all of these
Yeah.
things about the medications and the procedures that my patient might have, or the devices, or whatever they had. And I was ready. I was always ready. I
Nice.
was prepared, and she was amazing. She was intense, intimidating. She wasn't mean, but she was very intimidating just because her reputation. But yeah, I loved it. Loved
Yeah.
it.
That's amazing. It's always interesting. I had one of those faculty members. They people would say like she would make your patient care plan like bleed red because she loved using red pens. But you learn so much because she gave so much feedback. I'm like, okay, I get that. Okay, I see this. But yeah, during the time, the experience feels overwhelming. Uh,
Absolutely.
but
It
when
feels
you
like you
walk,
can never do anything right.
right? But when you walk away from it, you're like, I learned probably more than I did anywhere else.
Exactly.
So it's good to have
Exactly.
that. It's good to have that kind of feedback as long as, hindsight is, what do they say? Hindsight is 50/50 or something like that. Um,
Right.
um, how did you decide? So did you go, so after finishing nursing program, did you know you wanted that mother baby kind of a thing, or did that happen
Um,
later?
you know, I am very much a planner, right? My
Yeah.
whole life, my I plan our family vacations, whether it's with the family or just my husband and I, like the year before, fully blown out, planned payments, whatever. And so I've always been that way. However, life never happens except for the vacations. The vacations happen as planned, but life otherwise never happens how I foresee it. So I honestly don't remember how I landed on Mother Baby. I knew I wanted to live in Atlanta uh, because me and my best friend went to Atlanta often during undergrad to party. And I was like, yeah, this is where I want to be. Totally not career related, but it just happened that you could have a great career in nursing in Atlanta as well. And I feel like I applied to positions at children's hospitals, Children's Healthcare of Atlanta specifically, um, during that time. And I don't know if I heard back or maybe it was a long process. I don't remember. But I ended up applying to Northside Hospital. Unbeknownst to me, a classmate had also applied there. They weren't hiring for labor and delivery, but they were hiring for a mother baby. And so me and my classmate ended up moving to Atlanta, not living together, but at the same time working in the same hospital, and literally knew that a week before graduation. We hadn't discussed it at all. It just happened to come up in class. And we're still great friends to this day. She was actually my women's health nurse practitioner for a while. So, yeah, that's how I ended up in Mother Baby, just all fate, I guess, and got there and absolutely loved it. I never worked in labor and delivery, but did everything else, but
Yeah.
loved it.
Yeah. That's great. Um, so your ambitions to party in Atlanta made you the scientist you are today. So
Exactly. You couldn't, I mean, it was during the time of like peak Atlanta hip hop. It was
yeah,
Outkast, T.I.,
nice.
Young Jeezy. Who wouldn't want to be there? I mean, especially as a black girl, black young woman growing up in South Carolina and then being at a predominantly white institution at University of South Carolina, I was just like, I want to be immersed
Mm,
in quote unquote blackness, whatever you want to call it. I wanted to be around, Atlanta is still the black mecca. So
yeah,
I just felt like I had to be there. And so it all worked out.
very
Career
nice.
and hip hop fun time. So
Beautiful. How did your career, let's talk about your career that's kind of led to where you are now. How did you decide you're
mhm.
going to move on and become a nurse practitioner and eventually get your doctoral degree? And how did you decide that's going to happen?
Yeah. So after every degree, I always said, oh my God, that was just awful. I'm never going back. And I would always go back. To the point my family actually does not believe that my PhD was it. They're like, surely she'll end up going back to school for something. I'm like, there's nothing left. I'm not doing it. But so, and this may not be the case with all hospitals in the South. even during my clinical rotation in undergrad, and then some physicians once I was practicing in Atlanta, there's still this very much hierarchy of you listen to what the doctor tells you to do, what the physician tells you to do. We were still expected to get up out of our seats if the
Mm,
physicians came around. There was nowhere for them to sit. We couldn't question them. We had to be very polite when we called them for orders or clarification on something they wrote. And anyone who knows me knows I tend to be a very opinionated person. That's developed over time. I wasn't necessarily always that way as a novice nurse, but eventually I just got sick of being the one who's with the patient 12 hours, because in Atlanta we had 12-hour shifts, and really understanding what the patient wanted, and maybe being able to voice that with the physician depending on who they were, and maybe not. And just having no, I felt like I didn't have much say so. Or, they always say nurses are advocates for their patients and they really center the patient's needs and desires. And there was a barrier there for me to really be able to ensure that my patients' voices were heard and respected and considered. I also didn't like being told what to do a lot, especially when I knew there were better options. I'd be like, that doesn't make sense why this baby can't go home on phototherapy. I just think you're uncomfortable. It's not that there's no evidence around this. And so I was like, you know what? I'm going to go back to school and I'm going to become a nurse practitioner, um, specifically a pediatric nurse practitioner, so that I could have more authority, ability to hear my patients, and the families, and be able to do something about their
yeah.
concerns. And so I did. I went back and got my master's in nursing and pediatric primary care, or whatever it's called, at Georgia State in Atlanta. Still practiced at the same hospital doing inpatient newborn care. Um, yeah, and I still, would bounce around in my registered nurse role and lactation, or I still was there in many different capacities. But eventually I did go on to do primary care in a pediatric office in more rural Georgia. And that's when I learned, okay, what they told you being a nurse practitioner would be like in nursing school actually is not that at all. In that practice specifically. And complete transparency, I was miserable, because I had visits scheduled every 10 minutes. Didn't
Oh,
matter if it
wow.
was, exactly.
Yeah.
Didn't matter if it was a well child visit. Didn't matter if it was a sick visit. Even if there were multiple siblings who maybe thought they had lice or the flu, they were all scheduled in one 10-minute appointment, because it was a pretty high proportion of families who had Medicaid. And so
Yeah.
for reimbursement purposes, it's like we gotta see as many. In my mind, primary care based on my experiences during my clinical rotations, during my master's program, was you sit and you bond and you talk and you get to know them and you see them often because they're coming in. And there was this real, I don't know, bonding that happened. And you got to
Yeah.
see these kids grow up and you got to know their families. And in that 10-minute visit scheduling scheme, I could not, it was still there because that's just who I am. And I still wanted that rapport with my families to have that confidence for them to have confidence in me and trust and all those things. But it just, you knew as you're sitting there chatting and getting to know them, and oh, your mom is visiting, so nice to, you knew there was like three more families already waiting and you're so behind and you don't want them to be upset because you're
Yeah.
behind, but you also don't want this family to feel like she's just rushing in and out, so it was it was difficult. It was very stressful. I also had my daughter, who by then was maybe 3 or 4, and I had to get her from school, and I would just be exhausted. I didn't have anything to give.
Yeah.
And so I was like, let me get out of this situation. So I went back to being a nurse practitioner in inpatient care. for newborns again.
Yeah.
And so, yeah, that's sort of how that evolved. Not that everyone's experience as a nurse practitioner is the same, but when the more you learn about reimbursement and different payment models, insurance providers, that becomes, you know, they can dictate a lot. I think I went back to get my PhD in nursing because again, people were telling me to do things that I felt like, well, this is not what the evidence says. Um, why are you telling me to do this? And maybe I should be part of, doing the research that builds this body of evidence to inform decisions. Oftentimes, it wasn't so much the pediatrician who was in South Carolina. Sorry, in Georgia, you have to have a supervising physician. So it wasn't necessarily my supervising physician that was telling me things contradictory to the evidence. It was usually insurers.
Mm,
So my patients who had Medicaid would often come in with a certain condition, and I would diagnose them and prescribe what was seen as the gold standard or top tier medicine for treatment. And I would often get calls back from Medicaid saying, like, no, 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 girl, you can't give them this medication. You got to start with this one. Yes, we know that this is the most effective medication that you prescribed. However, based on reimbursement models and blah blah blah, you need to start with this, let's call it tier 3 a lower effective.
yeah.
And if that doesn't work, then you work your way up this ladder and blah blah blah. And I was just like, what is happening? This
So ridiculous.
cannot be, it's so ridiculous. And so between that and still practicing as a nurse here and there with pregnant and postpartum women, or people who identify otherwise, gender expansive parents. I often, even as the nurse practitioner for their baby, right? I would go in to share with them what I saw on exam or what their labs mean, and they were usually ask those questions or whatever. And then they say, I really just want to ask you something else. I never had high blood pressure before, and now I have it after giving birth. And nobody's telling me why. They're just giving me all these medications. And I'm scared. And they're telling me I'm
Yeah.
supposed to go home today. Literally, what this Black woman told me, new mother, first baby, terrified, which I would be too if I never had high blood pressure ever, not even during pregnancy. And all of a sudden I do now. And they're just like, oh, you take the medicine and go home. It's usually opposite, right? And there was literally nothing I could do um, to support her directly because I wasn't her clinician. And so, talking with her OB and the OB being like, why are you calling me? You're for the baby. What are you? I've told her that. And I'm like, well, she doesn't understand. Or maybe you need to tell her in a different way, but there was only so much I could do. But just those repeated instances of being there for the baby and the family saying, nobody's listening to us. We don't understand this. Why do they do it? Nobody told us the baby wouldn't come home with us. All these different things around the quality of care that I felt compelled to go back to school again for the last time to do research to better understand where's the mismatch between what patients, not only what they want and desire, but what they deserve, and what is the standard of care, and why is there this mismatch, and what can we do to improve the quality of care that we provide so that people aren't terrified and scared and ignored and dismissed. So that was plus my own experiences, while I was pregnant.
Yeah.
Despite being a nurse and despite choosing a practice that I knew the OBs and I was like, oh, I can trust them. Also, I was like, if I have a son, I need someone who can do circumcisions well. And there are many people that don't. I don't want them. There's so many things. As a nurse, you have all that inside scoop. And despite all that, I still had an encounter with a she wasn't a midwife. She was a women's health nurse practitioner who was very rude to me. And I felt like maybe she doesn't know I'm a nurse. Maybe she thinks I'm whatever. Maybe it's because I'm Black. Maybe it's because she's not Black. Maybe it's because of her experiences with other Black women. I also wasn't married, and my child's father wasn't at that appointment with me. So maybe she thought I'm just a young single Black woman. I don't know what she thought. However, I know how it made me feel. So at this appointment, I was diagnosed with um, pregnancy induced hypertension, which I was 26. I never had blood pressure issues. And
Yeah.
all of a sudden, my blood pressure is 150 over 100. And I'm seeing like the floating stars, like Looney Tunes, and all those things. And she says, you need to take this serious because if you don't, and if we had to induce you or if your baby came now, it's not likely they would live. They would probably die. So you need to take this serious. And I'm just like, what the hell? Why do you think I'm not taking this serious? I'm not laughing. I'm not like, oh, whatever. My baby will be fine.
Yeah.
As she's telling me what's going on, I'm sitting here because I'm a nurse and work mother baby, know all the things that could happen with this diagnosis. And then probably, I imagine I was just stunned and didn't respond at all. And I'm alone.
Yeah.
So I just could not believe that someone would speak to someone in this way with getting this sort of news. Speak to
Yeah.
them this way, regardless of the news, but definitely in this setting. And so I was just like, no, 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 no. And that coupled with, the families who I'm caring for that are also feeling ignored and mistreated and misunderstood. I was like, it can't just be, oh, well, only Black women have these issues, or, they just don't understand, or, well, they didn't get prenatal care, all these dismissive, blaming Black women for their outcomes. When I'm like, no, it's not just that. It's not, that could be a small part, but
Yeah.
what is clinicians and healthcare systems role in this? And so here we are, however
Yeah.
many years later. That was the reason I went back to get my doctorate, so that I could be part of the solution, um, and not just another, I don't want to say victim because that's not the correct word, but not just another person who was mistreated and unheard. I
Yeah.
wanted to make sure that not only my voice was heard, but also other people who look like me who have similar experiences.
Yeah.
That was a long-winded way to tell you about my nursing
No, no,
career
no, no. That was
choices.
perfect. No, so I'm just thinking how that impacted your experience in your PhD program because you really saw it. Because so many people, I don't want to say so many people, I don't have the statistics for this, but uh, but I know people who go into their PhD programs and they use just some random data sets and, they do secondary data analysis, they get their PhD and they move on. And there's really not like a core cause that's put them there. So now I'm thinking, how did that experience and those experiences change your experience in your PhD program? Did that put extra
Mhm.
pressure on you, or did that help drive you more?
Yeah, definitely helped drive me more, because I felt like I was there not only for myself, not only just my own, I want to see if I can do this, or,
Yeah,
all these organizations say you should get the highest degree, and I'm fulfilling that. It
yeah,
was more so I was doing this not only for myself, but in service of others. And so I didn't feel pressure. I don't know. Some people say I don't react to most things. I'm not, I just didn't feel pressured or stressed about why I was there. Yes, again, it was challenging curriculum and challenging phase of my life, but I got it done. And yeah, I
yeah.
felt like I was supposed to be there.
Yeah,
So
that's cool. Now from, I mean, just a little bit. So I was one of those people that went into my PhD program, um, because I was like, the 2010, the Future of Nursing report came out in like 2010, and I read it, and I'm like, yeah, I want to do that. And then the other piece of me was like, I never want to be in a situation where I don't have the degree, but I'm qualified for the work, or it's a work
Mhm.
that I want to do, but the degree thing is I never wanted to be in that situation.
Mhm.
Um, and then once I got my PhD, I realized some places want you to have a postdoc, and I'm like, oh, I'm done. I'm only, this is it. I'm not doing anymore. But no,
Right.
but it wasn't until I got into my PhD program where I just by sort of accident found like the passion that moved me through the program and continues to lead a lot of my work. So it's
Mhm.
interesting. That's why I was curious. I'm like, how did that change your experience? Because mine didn't happen till like year two of my PhD program that I was like, oh,
Ah, I see.
I
I
have my
see.
aha of why I'm doing this, as
Mhm.
opposed to I'm doing it because I need to have it, right? So
Yeah. I think another part for me was that there was not a lot of secondary data sets, or there
yeah,
weren't a lot of data sets related to discrimination or
yeah,
quality of care that was qualitative. I mean, we have plenty of prams and all these. Well, we can still access pram on some repositories, right? But there weren't the questions being asked that I wanted to get to.
yeah,
So I did have to do primary data collection for my
yeah,
dissertation, um, because it just wasn't there. So that even that was like you were definitely doing what you should be. You are needed. Your work is needed. Keep going. It may be
yeah,
difficult, it may feel like you're the only one, but keep going. So, I mean, my professors were very supportive, although they weren't doing research in the same, topics that I was, but they were still
yeah.
very much acknowledged that it was much needed. I too, when I finished my PhD, was like, okay, I guess I'll go and be a professor now. Like, and they were like, well, where's your postdoc? And I was like, you've got to be kidding me. Nobody said I had to
Yeah.
have a postdoc. Like, what? I also graduated, defended my dissertation July of 2020. So, like, what what are you saying?
Yeah.
This is another thing that I have to do. There were some teaching universities, right, that would
Yeah.
definitely welcome me, but I didn't want like an 18 credit course load of teaching as a new teacher my
Yeah.
like second semester or whatever. They're like, oh, we'll slowly increase. I'm like, well, I'm starting with 12 and then I'll end up with 18. I don't know what your definition of slow is here.
Yeah.
So yeah, I did go back. I which is my family's point. I did go and do a postdoc so that I could
Yeah.
focus more so on research. But
Yeah.
yeah, I feel like there's so much of nursing as a discipline, but also depending on your career choice or your degree, that's like this hidden thing that's not often talked about.
Yeah.
Um, and you just have to figure it out as you go, which isn't
Yeah.
always the best feeling. So,
Right? Yeah. So I did exactly that. I did go into a teaching uh, university right after I grad. Actually, during while I was, they hired me on part time, and then they hired me as tenure track. And this is
mhm,
at Cal State LA when I was at Cal State LA. So I taught there for a number of years as an assistant professor, and then unfortunately, pandemic happened. The sort of prices of everything went up, and I saw myself slowly dipping into my savings account just to pay bills. I'm like, this is
mhm.
not sustainable. And that's only, I love teaching, but I had to leave. I was like, this is
Yeah.
not the Cal State system. The way they pay is like, it's not from a family of four living in LA.
Mm-mm.
It's not a sustainable model. So I hope at some point to do something about that. But who knows? But yeah, I actually, during that same time, during like 2020, I started this podcast, and I happened to have Dr. Davidson on my podcast, she was at the time the dean of Johns Hopkins,
Ah,
and
okay.
she's the one that says I never did a postdoc, and she was the dean of Johns Hopkins. I'm like, huh, I don't need to do a postdoc. That's
Right.
my validation that I
Exactly.
don't need to do a postdoc. I'm like, thank you. I'm like, I can't afford to do a postdoc because I've got a mortgage, wife, two kids. I'm like, I can't do a postdoc. So
Yes.
it's
All
quite
the
a,
other factors. I definitely, so some of the teaching universities that would offer me a position, they weren't paying well at all.
yeah,
Even for Atlanta cost of living, they weren't paying
yeah.
enough. They weren't paying as much as I was making as a nurse practitioner,
Oh yeah,
even
definitely not.
part-time nurse
And
practitioner.
I don't understand that. I don't understand how the universities justify that. Like you are, if you're a professor, especially in a tenure track position, or if you're a tenured position, I can't understand how, like some of my students that were leaving and graduating from my program were making more than I was, teaching them what to do. I was like,
Exactly.
I was like, this makes zero sense that we're
Zero.
justifying this as a profession. I'm like, oh, and I remember somebody said, oh, I hope, this is when I was in my PhD program. Somebody had mentioned, oh, I hope you're taking a vow of poverty. I'm like, why are we taking a vow of poverty if we're
No,
going to be
that
at the
doesn't work with
like
my
at the
travel plans.
it's like you're at the peak of the profession, you have that terminal degree in the profession, but you're making less than people just entering into the profession. Like it makes no sense
It doesn't make
whatsoever.
any sense.
At some point, the profession needs to adjust itself on that and
Yeah.
make
I
changes.
and I struggle with that too because so my postdoc actually paid well
Yeah.
compared to other postdocs. Shout out to National Clinician Scholars Program.
Oh, beautiful.
Currently, seeking applicants. Deadline July 15th.
Yeah.
Anyway, um, yeah, I struggle with that because so often, even my physician colleagues and friends say that who tend, they get paid more than us.
Yeah.
But I feel like faculty and university systems, whatever, take us for granted that, oh, you want to do this because it's a calling or you're here to
Yeah.
serve people. It's not just about, making money. I wonder if lawyers are told,
Yeah.
well, maybe public defenders or pro bono, they do pro bono work. I don't know, but I feel like there aren't many disciplines that do what we do,
Yeah.
and are often regarded as, the most respectful profession, or you can literally see how we impact the health of people, their lives, their quality of life, and are just told to take a vow of poverty.
Yeah.
In what world? In this economy, who would do
This
that?
economy,
Who can
exactly.
do that?
Yeah.
Why would that be the expectation
Yeah. It
when,
doesn't
like
make
you
sense.
said, whatever metrics are put out that nurses need these terminal degrees and they need
Yeah.
this, that, and a third, and then just say, "Well, good job, you did it, and
Yeah.
now you'll be poor."
Now
No,
now you're gonna make. When I went from service to academia. I took almost a 45% pay cut. I was like, that makes no sense whatsoever. Luckily,
none.
I had a HRSA, like the Nurse Corps grant
Hmm.
thing that paid
Hmm.
a good chunk of was paying me a good, so I didn't have to worry about.
Hmm.
At the time, I didn't have to worry about paying any of my loans back or anything. But that whole thing was ridiculous. The pay is just
Yeah,
ridiculous. Like
yeah.
straight across. Even the best universities don't pay enough
Hmm.
compared to what nurses can make on the outside world, and it just doesn't seem to be the will in the university system to
Right.
up the ante on that one. All right, very cool. I want to talk about a lot of things with you. Maybe another show, uh, but I want to talk about your work at Rand because I'm going to put it out there. I applied to Rand and they said thanks, but no thanks. Uh, so tell me how you end up, what is Rand first of all for those who haven't heard about Rand, and then what is your role within Rand?
Yeah, I feel like my how I describe brand is never it never really lets people know exactly what it is, especially so many people who are used to academic oriented nursing
Yeah,
research. But RAND Corporation is a nonprofit, nonpartisan research sort of think tank organization. And there are just a bunch of researchers with great ideas
yeah,
um, seeking answers to all the questions that are relevant to policy. So policy being legislation or, informing policymakers on certain decisions of whether this should be a policy or not, or this is a policy. Is it a good one? Is it
yeah,
doing what we hoped it would? If not, how could it? All those things. But also clinical practice. So there's a healthcare division, which is the division I'm in, where we seek to improve the quality of care and lives for citizens, not just in the US, but globally as well. So we do all sorts of research. Um, so similar to academia, in that you can explore, NIH or wherever, PCORI,
yeah,
all these different funding institutions, or you can have different contracts, like if a county has an RFP for a request for proposals about something
yeah,
that you're interested in and have expertise in. So that's sort of, we all do research related to different various topics.
yeah.
And so I ended up at Rand. Well, I applied and they liked me. I don't know why they didn't like you, Ali, but
If in their defense, I was brand new out of school when I applied,
oh yeah, yeah, yeah.
yeah. But I
That's
figured
not
my
like you.
topic was sexy enough for them to give me a time of day, but they didn't.
Yeah,
But that's okay.
yeah.
Maybe a
Okay.
different
Did you
time.
have your beard? Maybe did you have your
I
beard or
did.
no?
I did have my
Oh,
beard.
so I
Yeah,
don't know. I'm at a
yeah,
loss
yeah. Me
because the
too.
beard really increases.
I didn't even put in
There
my picture. I should have put it in a picture. I just
you
applied.
go. You should have. It is. It is. And it depends on. I think in academia, it's not necessarily research has to be policy relevant, right?
Yeah,
It could just be, I'm interested in this.
right.
And if you have a way of, acquiring funding or agreeing to teach, then you're in kind of. Maybe it's more rigorous
Yeah.
than that. I'm sure it is, but you know what I mean. Um,
It doesn't
and so
have
it's
to, it doesn't have to be policy related. It could just be
exactly.
knowledge for the sake of knowledge.
Exactly. And at RAM, we're definitely, it has to be centered around policy.
Yeah.
And yeah, so one of my mentors during my postdoc at UCLA, Bob Brook, who, even though he is now 81, is still one of the most progressive thinking people I have been fortunate to meet with. So he's one of my mentors, and I was really just talking to him about the Black maternal health crisis in this country. And he said, we were having this discussion over lunch, like at his favorite Mexican restaurant here in Santa Monica. And he says, wow, okay, this sounds like a massive problem. And, you could be at UCLA or whatever and do small studies and figure out how to improve care in LA County or whatever. And even being a nurse practitioner, you could do, what you could there, reaching one patient, one family at a time. He said, but with a massive issue like this, you need to work somewhere that has an equally massive impact, the
Mm,
highest chance of really addressing this. And you should think about Rand, because he also used to be the director of healthcare at Rand way, many ages ago. And I was just honestly somewhat intimidated because in my mind, again, my life plan was okay, I'll do the postdoc and then I'll be at a research intensive university and then I'll be
yeah.
on tenure track and then blah blah blah. And so this unknown land of, non-academic research career, I didn't know what that looked like for
Yeah.
me or and so but he made a great point is that if this is such a massive issue, there should be legislation to address it, not just one clinician here and there trying to do what they can to improve care. Yes, that's needed, but also it sounds like the standards of care should be addressed, and maybe reimbursement models should be based on the quality of care and patients' experiences, not just a, can I talk to, um, not public relations, but when you're a patient and you're not satisfied and you want to talk to somebody
Like
about
their
it.
customer relations or something like that.
Right. Yeah. Because he said it's not just this one thing happened this
Mhm.
one time in this one hospital in this one city. Said it's a nationwide, even global issue because we know the
Yeah,
UK has similar issues, still better outcomes, but similar discriminatory practices. And so I was
yeah,
like, oh, yeah, that's a good point. And so then my interest was piqued and I learned more about RAND. And yeah, I applied and
yeah. That's
got in.
amazing. And that's the thing. Like most people, like nurse. I don't know why nursing's like this, but not to talk bad about nursing. I'm going to talk bad about nursing for a second. We 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 put people on these tracks and don't give them any other options, or don't give them. And then like me, like I've been in so many situations where I'm like, why can't I do that? Like I know the job description doesn't say a registered nurse.
Right.
But there's no reason I couldn't do that. I have the skill set, I have the knowledge, I have the experience. But because it doesn't say RN next to that position, like nursing doesn't necessarily encourage you to say, you know what, don't worry about academia or service. Do this other thing and
Hmm.
create your own pathway through that. And I wish we were better as a profession in doing that because so many people like yourself that I know are making incredible impact in it's not just nursing, but it's like in the health system, within
Right.
communities, nationally, internationally. And they tend to be individuals that aren't necessarily walking a very specific path, is they have sort of created this alternate. I want to good marvel on you for a second, like this alternate universe thing, right? That they've created, but they are still doing incredible work. But you'll never read about that job description when you take any courses because
No.
it's not the traditional pathway.
Mm-mm. And my postdoc was at UCLA, but we were housed in the School of Medicine and it was interprofessional. So it was nurses and physicians.
Yeah,
But physicians really, I don't know if they're necessarily taught, pathways outside of academia or, private practice or whatever, but they definitely discuss it. Like it's not
yeah,
a taboo thing. We,
yeah,
during my postdoc, had, traditional academic clinician researchers come and talk to us about their career. But then we had, physicians who did a independent, startup providing high
yeah,
acuity care in homes
yeah,
because people had mobility or access issues and couldn't go to all these different visits with different specialists
yeah,
because of the multiple comorbidities they had, and just completely different. Even gaming, like
yeah,
gaming in healthcare, what you could do as a gamer and a clinician to
yeah,
improve healthcare, totally out of the box things that I still don't have many nurses know about or discuss or know how to do that. It's
yeah,
not a well paved or well discussed pathway. So yeah, my I credit my postdoc for many things. One, for giving me a mental break, honestly, after defending a dissertation during the pandemic and still practicing as a nurse practitioner full time in the midst of it all. But also just they broadened my horizon
yeah,
on what I could do as a nurse scientist for sure.
yeah, yeah. That's great. I have a lot of thoughts, but I also know we're almost at time. So I'm gonna have to
I'm a
bring you.
talker, so there's that.
I need to bring you back. I definitely need to bring you back. Or yeah, I don't need to bring you back. We'll just have lunch. So I can get
Or we could do
my
both.
or we could do both. I don't want to take too much of your time, but yeah, we could definitely do both. Um, so just because we're almost at time, I want to give you a few minutes for any last thoughts. This conversation, I could listen to you all day, but just want to give you some time. Any last thoughts or anything you want to share?
Oh, that's such a hard thing. Like any last thoughts? I don't know. I will say that like I said, I feel like I was raised to be or born into being a nurse. But one of the things that really helped me get to this point is the support of people who believed in me. And even despite people who will be like, well, no, you can't do that. Or are you sure you should do this? Or you're moving to California. Why? You don't have family out there. If there are nursing students, scholars, whomever, even non-nursing, I don't know your target audience or your audience for the podcast, but in search of support, guidance, just someone to, be there and be real but supportive, I'm available. I like to be that person for others because I had to, find people to
Yeah.
be that for me. But just remember, regardless of how you choose to improve the lives of others and the patients you care for, whether that's working at a institution like Rand or a university or a community organization. I don't know, just make sure it aligns with your purpose so that if the paycheck is not what you'd hoped or if the hours are longer, at least you're still fulfilling your purpose. So
Yeah. Yeah, absolutely. And just for my audience, Dr. James does have a social media presence.
I do. I've tried to do better with that. But yes, I do. I'm on all I won't say all because there are so many
Oh
now
yeah,
and
yeah, yeah.
I'm 42. And I'm just like, you know what? I still have trouble navigating TikTok. My daughter has to help. So yes, I'm on TikTok, LinkedIn, and Instagram.
Awesome.
Dr. Kortney James almost. Dr. Kortney James. But yeah. Kortney.
I
I've
will, I
said
will,
that since I was little. It's
I will,
Courtney with the K.
I will put that into the website so anybody who's looking to connect with Dr. James, they can do that. Thank you so much. Greatly appreciate you being here. We need to do lunch
Yeah.
soon. It's the summertime, so I'm hoping
Yeah.
my travel schedule has calmed down. I'm not going to as many conferences during the summer, so it's a little bit of
Good.
downtime for me. So
Good.
thank you again for being here. We've been listening to Dr. Courtney Floyd James from Rand Corporation, scientist extraordinaire. So thank you for being with us, and I look forward to bringing you more incredible nursing colleagues in the future. Thank you.
Yes. Thank you.
Thanks for joining me on the RN Mentor Podcast, a production of RN Mentor Consulting. Please don't forget to follow and check out rnmentor.org for additional content, speakers, podcast notes, and more. Until next time, fair winds and following seas.